UCSF. His whole thing, he's one of these new guys. He's like a naturopath with an MD.
Uh-huh.
Integrative medicine. We'll get some soon. 10 years behind California, but I mean, he bases everything on inflammation. Pain is caused by inflammation, which is not true, but that's what he thinks. So he encouraged me to go on an anti-inflammation diet. So you could try that. I could get you some information. It might help.
Yeah, I've heard that before too, about certain things that I shouldn't eat.
Well, it's
or-
pretty close to a Mediterranean diet with a lot of fish oil.
Yeah.
And trying to
Yeah.
stay away from meat and
Yeah.
things like that, right?
Kind of
And there is some
gluten thing.
truth to anti-inflammatory being helpful, that a lot of pain is due to inflammation.
Right, but if it's not, there kind of is an assumption
Oh, and I
that it
forgot the
is.
plantar fasciitis.
And for me, inflammation is very poorly defined. I think people use it differently.
Yeah.
And so like, if I have that part of my blood tested for inflammation, I forget what it is, and it's negative, then I don't have inflammation. Or that's a different type
Sedimentation
of
rate or
inflammation.
CRP or
If I have a negative CRP, then why can't I tell a doctor, no, I don't have inflammation problems?
the inflammatory cascade has like 5 different pathways to it. And the one that's most typically attended to is the prostaglandin pathway, which is what nonsteroidals operate in. But it turns out that there's several other pathways for inflammation, and I don't think we have measurements for all the pathways. So if you have an obvious, like if I do a sed rate or CRP on you and it's elevated, then you got something for sure going on. It's not
Right.
specific, but it's a very sensitive test. Then you've got something to go on. But I don't think we test the 4 other pathways of inflammation. You know, the cytokines and the bradykinin and
Right.
all these other things, and I can't really spout them. I bet there's a chapter on it in that book.
Is homocysteine an indicator of inflammation too?
Cardiac, yes,
Oh, yeah, yeah.
but not necessarily anything else.
Anyway, I'm negative for all the inflammation stuff,
Yeah.
but that doesn't stop.
When I think
people-
homocysteine, I think Michelangelo was a homosexual in the Sistine Chapel, painting.
Okay.
There's a homocysteine for you.
That helps you.
I don't know why I came up with that. But yeah, so you get a normal CRP and homocysteine, and all your inflammatory markers are not showing anything, and yet your doctors say, well, there must be some inflammation somewhere.
Because they're locked into that already before I walk through the door. At least this guy was.
Yeah. Well, that's a great term, and let's come back to it, because I think if your only tool is a hammer,
You're gonna use it.
everything looks like a nail. You know,
Yeah.
and a lot of us have just one tool, and so and I do that. I mean, I go, every patient I see in pain, I go, medical marijuana, because I prescribe it, and I've heard so many miracles about it that I go, you gotta at least try this. And people say, oh no, it makes me anxious, and I can't really oversell it, but it's like, I've just heard so many miracles that that's one of my tools. And people who come to me, they hear it from me. Now, I try not to beat them over the head with it, but the other reason I promote it is that the whole opiate thing is being run by crazy people. And the whole system is, if you need a narcotic pain reliever for your chronic pain, you're locked into a death struggle, essentially, I think, because there's always somebody trying to take them away from you, or tell you that you don't need them, or tell you that they're bad for you, even though you've tried all the other alternatives. It's sort of like in the ER when we say, we'd like to give you something for pain, what are you allergic to? And the patient says, well, I'm allergic to Toradol, and I'm allergic to ibuprofen, and don't you dare give me acetaminophen because it'll upset my stomach, and that other stuff didn't work, and everybody's rolling their eyes already because, oh, well, we know what you want. You just want the morphine.
You're just a drug seeker.
Yeah, and we know what that's about, and get out of here, you know. And it's like, so even if you tried everything and they failed, that puts you into a category called drug seeker. But here's the thing, I mean, I've got a prescription pad. I know. And so everybody who sees me is a drug seeker. I mean, you're either seeking me for colchicine or Indocin or prednisone for your gout, and you should be on allopurinol, you know,
Yeah, I have
or you're
that
seeing
too.
me for methotrexate for your arthritis, and who knows about your plantar fasciitis, how that's going to clear up.
Oh, I've had that.
Yeah. Oh,
I'll
that's
tell you about that.
horrible. I've had it too. I was stupid. I was young. Now I'm old and stupid. I mean, you know, and Linda, you have 2 broken legs, and you know, and this guy's got this grinder trying to straighten your leg out when you're age 5. And Rob, we haven't talked about you yet, but we will. And it's like everybody's seeking something because we all want relief.
And that's what's.
And because of your training, you're a pill pusher.
Yeah, I mean, I got 2
See, I
things.
turned
I got a knife and a prescription pad. That's all I got.